Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. So we were discussing about the convulsion, seizure, epilepsy, etc. So we already completed 2 or 3 classes. Please don't forget to subscribe my channel and also please give your valuable comments. In the last class, we were discussing about abnormal sensory perceptions by the patient during the time of the seizure, which is a part and parcel of the seizure component. Okay. Now today we will see the abnormal psychomotor experiences during the time of the seizure, because these are the 3 components we know: motor, sensory and psychomotor. And what are the psychomotor component of the seizure and how patient will going to feel it? So that we will going to see today. Psychological changes with some of the motor activity, so that is called a psychomotor activity. Now what actually happens is, what do you mean by psychomotor? There is also psychological changes, there is also some motor activity. Okay, so then we will call it as psychomotor activities. So in this case, this psychomotor activity is abnormal. So basically this deals with the autonomic nervous system. Therefore we say motor, sensory and autonomic activities. Psychomotor activity is nothing but our autonomic nervous system activities. Okay, and predominantly the psychomotor experiences are seen when the abnormal electrical activity is spreading through the temporal lobe. Okay, when it is spreading through the temporal lobe, predominantly we will get psychomotor abnormalities. And the primitive functions and connections with the limbic system. Now what is the importance of temporal lobe is, temporal lobe is one of the important lobe and it is considered as the most primitive lobe. That means even in the lower animals also this temporal lobe will be there, and that carries most of the primitive functions of our body. Primitive functions, for example sexual activity, that is one of the most primitive. Taste and perception, smell, okay, related to food, that is also one of the most primitive quality of the person. Even the lower animals also thrive for the food. Okay, they're also living by means of food, and their only attempt is always to survive and to have the food, isn't it? Similarly, these are considered as primitive functions of our body, so they are present in the human beings also. And all these primitive functions will be carried by the temporal lobe of the brain, okay, cerebrum. Therefore when temporal lobe is abnormally stimulated by an electrical discharge, okay, so we will have all these problems. We will have problem related to smell, problems related to then the taste perception, problem related to sexual activity. So therefore this is quite important. We will also have a term called as temporal lobe epilepsy, that we will see later. Okay, so psychomotor experiences means predominantly there is involvement of the temporal lobe and also limbic system, because this limbic system and temporal lobe, they carry on the most primitive functions. This is one important thing. So in a patient of a seizure or epilepsy, you can find also some of the psychomotor experiences when that abnormal seizure activity is going on the temporal lobe and basal ganglia level. Another important psychomotor activity is a fantasy and reality. Fantasy and reality. Now, temporal lobe also have one more important function, that is it is able to differentiate between reality and fantasy. Okay, now many things are fantasy or imaginary are there. Okay, so whether they are real or imaginary, so who will going to decide? That is temporal lobe will going to decide. Okay, a person having problem in the temporal lobe, or when there is abnormal electrical discharge is going on in the temporal lobe, then he may be failing to differentiate between the fantasy and reality, and that may create so many problems. So he may think imaginary things as reality. Okay, so this is one of the main function of the temporal lobe. We know small kids, they always want imaginary stories, isn't it? Small kids. The reason is their temporal lobe is not much developed. Therefore the imaginary stories they like always. If you say the real stories, they do not like. But imaginary stories, somebody is flowing, somebody is jumping, and all these imaginary stories they like very much, because in children temporal lobe is on the way of maturation. It is not completely matured, so therefore it is still believing in imaginary things. But once you get into the adult stage, your temporal lobe will completely grow, and now it is able to differentiate between the fantasy and reality. And so you cannot tell a imaginary story to a 10-year-old boy because he know what is reality. Okay, so similarly, this is also one of the main function of a temporal lobe. Another one is a familiarity and unfamiliarity. That is also the function of a temporal lobe. So abnormally, when temporal lobe is get stimulated, we will have a patient of a seizure will also have problem with this. So familiarity and unfamiliarity. Okay. Apart from that, temporal lobe is plays a very important role in the taste fiber, as I told earlier, primitive reflex, primitive sensations. So taste fibers. So patient may have an abnormal taste sense. Now, in many conditions, in Ayurveda we find tiktasyata, lavanasyata, okay, madurasyata, like sensations will be seen in jwara, etc. Okay, so this is actually, although he is not having that particular sense of taste, he is feeling that. Nobody is giving any tikta drug to him, but still he is having a feeling that. So that suggests that the temporal lobe has been abnormally stimulated, or there is some problem related to temporal lobe. Abnormal sexual activity. This is one more important thing. Sometimes temporal lobe epilepsy shows a very aggressive sexual activity or sexual behaviors, and the reason is the sexual activity, the most primitive sensation. So that is also managed by the temporal lobe. Okay. Now anger burst and anger when irritated. So angry and getting irritation, that is also the function of the temporal lobe and basal ganglia. Now in total, what I mean to say is during the time of the seizure or during the time of the epilepsy, if the abnormal electrical discharge flows through the temporal lobe, then every possibility that patient can develop all these symptoms, which are considered under psychomotor experiences, different psychomotor experiences. Okay, so therefore it is called as temporal lobe epilepsy. A separate name is given. Epilepsy, abnormal discharge when it is taking place in the temporal lobe, so he may have all these symptoms. Apart from that, so many other symptoms are also there. We will see in the next slide. So abnormal familiarity of the person. Okay, psychomotor experience, abnormal familiarity of the person. Now patient feel that I have seen this person somewhere. Actually they are meeting for the they're meeting for the first time, but still he has the feeling that I have seen somewhere. So this is again the temporal lobe problem. Okay, so sometime patient will have a feeling that I have visited this city already. Okay, he is visiting that city for the first time, but he will get such an idea or such a feeling that yeah, previously also I came here, like that. He will have a feeling. Okay, so usually this particular condition is called as deja vu, abnormal familiarity with a person or abnormal familiarity with a city or a place. So that is called deja vu. Okay, so this is one important thing. Now another important thing is he is not able to differentiate between the reality and fantasy, as I have explained earlier. Okay, so he is not able to differentiate between a cotton body, and he is not able to differentiate between a metallic body, and he is not able to differentiate between a real body, human body. Okay, by looking at a metallic body also he feels that yes, this is a real one, or by looking at a this doll and all, by looking at the cotton ball also he have a feeling that yes, this is a real one. He is not able to differentiate. And this particular condition where he is not able to differentiate between the reality and imaginary, and that is called as jameu. One is deja vu and another one is jameu. Okay, so this is also basically the function of a temporal lobe, and this comes under psychomotor experiences, abnormal psychomotor experiences. Now another is mood fluctuations. A patient of epilepsy or seizure will have these mood fluctuations, psychomotor experiences. Okay, sudden mood fluctuations will be there. Suddenly he start crying, suddenly he start staring. Okay, because there is abnormal stimulation of the frontal eye field, etc. Okay, this is not related to temporal lobe. First few are related to temporal lobe, which is exclusively called as temporal lobe epilepsy. Some other psychomotor experiences which are seen in a patient of seizure or epilepsy is this. There may be abnormal mood fluctuations, or patient may suddenly start staring at you. Okay, abnormal stimulation of the frontal eye field. When abnormal electrical discharge flowing through the frontal eye field area, suddenly he may start staring at you. Or there may be some abnormal eating habits, spitting habits, or abnormal behavior. So this can be also considered under psychomotor experience. During the time of the seizure, patient can develop all these symptoms. Then most important is the incontinence of the urine. We know that passing of the urine, passing of the stool, relaxation of the smooth muscles, and all these things are the function of a autonomic nerve system, sympathetic and parasympathetic. So when the autonomic nerve system is affected, along with the psychomotor activities, there will be also some of the abnormal autonomic nerve system problems, like excess sweating may be there because of the excess secretion of the sweat, or there may be excess secretion of the saliva. There is sudden passing of the incontinence of the urine, incontinence of the stool. So these things can happen. Okay, these all things are considered under, matters are considered under the psychomotor experiences during the time of the seizure. Now we are clear that during the time of the seizure, a patient may have the motor experiences, patient may have the sensory experiences, and patient may have the psychomotor experiences. Now we have to list this, and accordingly we have to decide where exactly the abnormal electrical discharge has been going on and how much area it is spreaded. Okay, therefore inquiring all these points is very, very important. So this is the basics. Now, what exactly epilepsy is? Epilepsy is nothing but a repeated seizure. A seizure, when it is occurring repeatedly, it is called as epilepsy. And what is a seizure? Seizure means abnormal motor activity, abnormal sensory activity, and abnormal psychomotor activity or autonomic activity. Now, same such episodes of the seizure, spontaneous process, when it occurs repeatedly, or when it occurs recurrently, or when it occurs spontaneously, along with the abnormal electrical discharge, it is called as epilepsy. Epilepsy is nothing but a seizure which is occurring repeatedly, recurrently, spontaneously, along with an abnormal electrical discharge. That is called as epilepsy. If a single episode is there, suppose only one single episode of attack is there, okay, paroxysm is there, so that is called as seizure. And same seizure, if it comes repeatedly, then you will call it as epilepsy. And in the epilepsy, again, there are 2 or 3 types that we will discuss later. Okay. Now, what is epilepsy now? This particular epilepsy may be an idiopathic epilepsy. This may be an grand mal epilepsy. This epilepsy may be generalized tonic-clonic epilepsy. This epilepsy may be petit mal epilepsy. This epilepsy may be Rolandic epilepsy. This epilepsy may be partial epilepsy, or this epilepsy may be temporal lobe epilepsy, or this epilepsy may be epilepsy syndromes that we'll discuss later. Okay, so these are the different types of epilepsy. What is the basic thing here? The seizures are occurring repeatedly, recurrently, spontaneously, with the abnormal electrical discharge. That's all. With the motor, sensory, and as well as autonomic nervous system involvement. So this is the basic again, and in the next class we will see why exactly the seizures start and why exactly the epilepsy develops, what is the cause. Such details we will see in the next class. Thank you very much. Don't forget to subscribe to my channel, and also please give your valuable comments. Thank you.